Hey Claires, it's your girl Court.is.Claire and welcome to my channel Court.is.Claire. Today this video is about prioritization for all you new nurses out there. So I know it's a lot of new nurses and you're probably getting ready to get off of orientation and fly the nest and be by yourself. This video is going to help you prioritize your day and get organized so you can have a successful shift. So if you're interested, stay tuned. Please don't forget to like and subscribe and leave me any comments, questions below. I love to help my new nurses, honey. I'm the nurse of the young, wait, what I want to say? I am the young OG nurse. I will give you all the knowledge that I can via internet. So stay tuned. Okay, so let's get right into it. So I have been getting a lot of questions, and I generally do get a lot of questions from young nurses about prioritizing their day and different things. And let me just, if you don't know me, let me tell you a little bit about myself. My name is Courtney. I'm a registered nurse. This year makes 10 years that I have been a registered nurse, and I've worked in different specialties. I've worked in med-surg tele, I've worked in ER, hospice, PACU, and most recently utilization review. So in those areas I am here to offer a wealth of knowledge. So one of the main questions that I've been getting from my new nurses is, how do you prioritize your day, especially for my floor nurses, my med-surg, my tele, my PCU nurses? And let me just say, number one, you're starting off, so it's going to be a little difficult to get yourself organized and to get yourself started. But I'm going to share with you what I used to do to prioritize my day. And you know what? Back in nursing school, we used to be like, what priorities? What you gonna do first? We used to think that was just like something that our teachers would say. But actually, even now with me doing utilization review, I use a lot of prioritization. You have to put out the highest burning fire first, which in your case, my floor nurse's case, would be the patient with the most acuity at that particular time. So I did a little mock. I'm not sure. Y'all drop down, leave in the comments below. Let me know, are you guys still getting a paper report where you can write the information during bedside report? Or are you guys just using your wows or cows or whatever you're using to do your documentation? Because for me, when I was a floor nurse, we always had a nurse's brain, and that is a actual paper, and that's how you keep track of your patients. And I urge you strongly, if you don't do that on your floor, I would say for you to start writing down the information, because there's no way in a 12-hour shift you can keep up with everything that's going on. So I would come in, so say my shift started at 7 a.m. I would come in, I would get my printed report, and I would also get an extra sheet of paper. So what I would do is, as the person is telling me, giving me a report, the outgoing nurse, I would write down, little things that she said to ensure that, I get a good picture, or at least a good history on the patient. And yeah, I know you're like, oh, the night shift nurse, they lying, or the day shift nurse, they don't know what's going on, and I'm stuck cleaning up the mess. That's neither here or there. I just get my report and I keep it moving. What I will say is, prior to getting a report, I know that you guys do bedside report now, but when I was coming up, we didn't do bedside reports. So I would urge you to go into all your rooms. Number one, to ensure that your patient is still alive. Number two, to ensure that you have a patent IV, or a patent IV that looks patent, and that your IV bags, your fluids and everything, and your tubing has been refilled, and the tubing is correct date for your IV tubing change, so that the dates are correct and that your outgoing nurse does not dump on you. So okay, back to the lesson at hand. After I'm done getting a report, I go sit down and I get my extra sheet of paper, and what I would do is let me get closer. This is just a mock write-up. Let me see, I hope I can get it right. So here I will put the room numbers. So I did 101. And if you are having a hard time keeping track of it like that, you could also use the patient stickers, right? And you put it here. So I have 5 patients written out. And what I would do is because you need to review your chart. that morning prior to you starting to go see your patients and introduce yourself and do your head to toe assessment with your morning meds, you should sit down at your computer, look at your lab values, look at your orders, and look at your medications that are due that day. So that way you get a head start on the patient, you get a little bit familiar. And if you feel like in your report that you didn't get the information that you needed, you could also read your H&P. So what I used to do was, like I said, write in the room numbers. I would write down what meds they had due that day, what meds, or if they had dressing changes, or if they had Foley's. I would write all this information down, so that way when I'm in the patient's room, I have a grip on what I need to be doing. And I also have a way to keep my time schedule with my patients. So room 1001, 9 a.m. I know he has 3 meds. Room 1002, 11 a.m. I know he has meds, but I also know he has a dressing change. And when you do this, this helps prioritize your day. A lot of people say, or a lot of young nurses say, well, how do I give a report? I'm gonna do a video for that. I ain't gonna even give y'all that. But this sheet will help you give report, because maybe the nurse that you're giving reports to said, well, did you do the dressing change? And you like, yes, I did my dressing change, and this is what happened. Or maybe while you're getting your information in the beginning of your shift, you write down your H&H and you say, okay, you know what, I know this went down. I know I called my attendant. This little extra sheet of paper is all the information of what you do in the run of a day, because we're so busy. We're passing meds, we're answering call lights, we're talking to physicians, we're talking to family, we're talking to our patients, we're doing assessments. There is no way that you can keep all this information in your head. But when you have everything that you need to do written down at the beginning of your shift, you know what you need to do in a run of a day. And trust me, I understand that you can't get everything done all the time. But remember, nursing is 24/7. It is a continuum of care. So if you don't get something done that you weren't able to get to, then okay, that's cool. You should pass it on. But always remember that you need to get your acuity things done. There should be nothing acute left. So for instance, if a physician ordered blood at noon in your shift, you should not be handing it off to the next shift unless the blood was not available. If you had a dressing change that needed to be done on your shift, that should not be handed off unless there was something that you could, if you had a cold or something like that. You have to be able to prioritize your day to get the most acute things done. So always remember to put out your highest fire first, and to keep a mental or a paper record of what you need to do, so that way your day is prioritized. So even look at here, 1004, I wrote that this patient has meds 9, 11, and 2, and the patient also has a Foley. So what you can do is when you're giving meds, you could also empty his Foley. Those are little things that you have to do to start grouping and making sure that the care is given and done and you're on track. But you could group your tasks. I know a lot of people, one of my new nurses, she was telling me that she would leave a room and they'll call her to come on. So a way to circumnavigate that is for you to say, okay, all right, Mr. Smith, I gave your 9 o'clock meds. I'm going to go and give my meds off to another patient. Go give them their meds. Is there anything that I could do for you before I leave the room? Because I don't want you to be waiting, because I might be tied up for a little moment in another room. Is there anything else that I could do for you before I leave? Maybe he'll tell you he needs a glass of water. Maybe he'll tell you this. But guess what? That's fine. Because once you set him up, you probably won't hear from him until the next time you have to round. Those are ways to help prioritize your day so you can have a smooth shift. So if you have any questions, any concerns, anything that old nurses, if you're watching this, anything you want to add to this wealth of knowledge, new nurses, if you have questions, drop them below in the comment box. Most importantly, I want you to know that I love you, but God loves you so much more. God bless you.